Health in South Africa, stories from birth to death, drawn from the National Income Dynamics Study. Measurements of health provide us with important information on the length and quality of the lives people lead. In 2008, 2010, 2011, and again in 2012, we asked a range of questions to a subset of the South African population about their health and well-being. So, NIDS provides us with a window into understanding the health outcomes and health behaviours for South Africans over time. Let us look at trends in mortality, because this information provides us with some initial insight into the most severe health problems. Between 2008 and 2012, about 5% of people who were in households surveyed in NIDS in 2008 had died. NIDS shows us that people's assessments of their health can be very good predictors of future mortality. We see that adult South Africans who describe their health more negatively than others are indeed more likely to be deceased in the near future. In fact, amongst South Africans who described their health as excellent in 2008, only about 3% were deceased by 2012. On the other hand, amongst those who described their health as fair in 2008, approximately 12% had died by 2012. And amongst those who described their health as poor, approximately 16% were deceased by 2012. So given that South Africans seem fairly good at assessing their own health, let us turn to some important kinds of health behaviors. We start with smoking, which has critical implications for cancers, stroke, lung diseases, as well as heart disease. Amongst adults who reported not smoking in 2008, about 7% reported that they were smoking in 2012. On the other hand, and more encouragingly, amongst adults who reported that they were smokers in 2008, 30% said they had quit by 2012. Looking at exercise as an important behavior with health implications. Not only do very few adults in South Africa regularly exercise, but there are very large fluctuations over time in the amount of exercise which people do. In 2008, about 14% of South African adults reported exercising at least 3 times a week. And this number dropped marginally to 13% in 2012. South Africans who report that they never exercise are unlikely to start exercising in the future. About 82% of those who reported never exercising in 2008 continued to remain inactive in 2012. And many of the most active South Africans became inactive over time. Half of the people who reported exercising more than 3 times a week in 2008 reported that they never exercised in 2012. So beyond lifestyle choices, how do South Africans protect themselves against ill health? Medical aid coverage is an important security net for South Africans when they become ill. Without it, they have to pay large sums for medical expenses out of their pockets. In 2008 and 2012, only about 16% of adults and 12% of children were covered by medical aid. And there are very large disparities in coverage between the race groups. Only about 10% of African adults were covered by medical aid in 2012, compared to 63% of white adults. And only 8% of African children were covered in 2012, compared to 61% of white children. Children are especially vulnerable to losing their medical aid safety net. About 34% lost their coverage between 2008 and 2012, compared to about 26% for adult South Africans. There are a number of interesting studies which use NIDS to help us better understand health in South Africa and could be of interest to policymakers and policy researchers. One study found that better health outcomes are positively associated with improved labor force participation rates. How do we leverage this virtuous cycle to better South Africa's health and economy? In another study, researchers found that factors such as social protection, employment, education, housing, and good infrastructure, such as suitable sanitation, were better predictors of health than income or poverty. So from a health perspective, where do policy preferences lie between job creation for the future and social protection now? Whilst another study documented the significant inequalities that exist in health outcomes, access to medical aid, and use of healthcare services between persons with and without disabilities. Is this, for example, another aspect of income and access to the labor market, or physical access and private insurance market forces? In fact, NIDS can provide us with much policy-relevant information around health. This video was drawn from the National Income Dynamics Study. We continually follow 28,000 South Africans throughout their lives and collect a huge amount of data every 2 years. It's designed to help you create better policy, informed by better research. It's available and it's free. Find us at www.nids.uct.ac.za. The National Income Dynamics Study, telling the stories of the people of South Africa.